So if we go back to sort of traditional way of looking at this, clinicians want to improve their services, do the best for their patients. From a financial perspective, if someone presents you with a business case on that, you instantly think, well, what's the return I'm going to get for this investment? But what we don't really look at is what's the investment we're making by not doing it. So what's the cost of failure? What's the cost of firefighting? And what's the cost of us continuing to do things the way we're doing without a focus on quality? And I think once you can start to address that, you can really understand how you can develop a business case for this. So we all want to reduce waste, we want to reduce variation, and we want to drive up quality. And it's very difficult to argue against those three things. And I think when you start to bring in the patient voice into that as well, it becomes even more difficult to argue against. And what we've presented in our business case for quality is trying to address all those things and actually suggest that you're not going to find one return on investment from this. You're not going to be able to present a business case that says by doing this we're going to save X, Y or Z. But what we are going to say is that there's a number of measures, and some of those won't be financial but are still a positive return to the organisation. That might be through staff engagement, it might be through clinical engagement, it will be through cost reduction, it will be through cost avoidance. And by bringing those things together, and just the way we apply the improvement methodology, you're going to tick off 1, 2, 3, maybe even 4 of those with some projects, but you will get a return against some of those. You just won't get one, and you've got to look at it as a multiplicity of factors, positive factors, by implementing a quality methodology. There's lots of things that come into value, and one thing we've been quite clear on is making sure that people don't understand value as meaning cost reduction. It's about how you can increase quality, provide efficiency and effectiveness at the same time. And sometimes the increase in quality may be greater than the value in terms of a cost reduction you get. Doesn't mean you shouldn't do it. It just means you need to be able to measure it. You need to understand the data that sits behind it and the impact that has on service users or staff or carers.